My name is Vernon Root, and I am from the Saugeen First Nation, and I'm recognized as an elder for the Joint Council of the Saugeen Ojibway Nation.
I'm Ogama Greg Nadjuan, Chippewa Nawash, unceded First Nation. Miigwech.
I'm Dr. Ian Arra, the Medical Officer of Health for Grey Bruce. I'm honored to be here. Thank you.
Councillor Nick Saunders from the Chippewas and Nawash.
Okay, we're here today to give recognition to the doctor for the work that he's been performing for us in our community during this pandemic times that we're in. We value the approach to having the virus encountered and to make sure that our people are safe. So the doctor's method of helping us, we have appreciated that, and it is with great honor today that I'm able to present in our way of recognition for the work that's being done to help save our people from any future viruses that might be around. So doctor, with this we give you the recognition and offer you the feather in terms of our honoring yourself for the work that you've been doing. And with this, we give you a feather. Thank you.
Thank you. I am honored and speechless, and it has been a privilege to work with you, to serve with you, and to serve the community. And it just the results that we had in the community, the low number of counts, really speaks to the success of all the parties and the partners around the table, and the strong leadership from the chief and the council. Thank you. I'm honored.
So as we move on, I as Chief will be introducing a few other people to come in and join us. A year ago today, I've been reminded this community announced a state of emergency 1 year ago today. Really not what we're getting into or how long would be into that state of emergency. One of the first things we did was we arranged to have a committee put together made up of people who made up the health team, the fire department, the police, social services. I probably am going to miss one or two, but it included communications, who is bringing us this event this afternoon. So this committee met for the year, every Wednesday. And what they did was they discussed, debated, came up with recommendations. The recommendations then went to Chief and Council, and we worked on these recommendations to make our community as safe as possible. I'd like to say one of these recommendations was we started having our food bank available to the community twice a week. We started organizing our fishermen to harvest fish, which we donated to friendship centers and others in the surrounding areas to make sure that our off-reserve membership and other Indigenous people were gifted with the harvest of fish. So much has happened, so many suggestions, which we followed up on. We started monitoring people coming into the community, not to make anyone's life difficult, but to try and provide as much protection as possible. There's so many things I can say that we opted to do over the year to make our community as safe as possible. We were extremely worried about our elderly and those with compromised issues of health. And today, as I stand here, it's hard not to get a bit emotional because we managed to do the 1 year with this pandemic upon us and really only had 2 positive cases reveal themselves in the community, which we addressed in a very fast order. I've spoken to the elders since the vaccine has become available, and they're elated. They're so pleased with the recommendations from the community, and they realize the sacrifices that we as a community managed to go through to make sure that we stayed safe and healthy. And I can't thank the doctor, Councillor Saunders, who has been a rock in the issue of providing services for the past year, the health unit, communications, social services, the food bank, the monitors. This, a year later, we deserve to acknowledge and celebrate. And this is early. We're honoring the doctor today. But I can guarantee you, when we're at the light at the end of the tunnel, when we're there, we will make sure that this community has a very, very large, long-awaited community celebration. Miigwech.